we presented different poems, different skits as a testimony to you to prove that we are ready to be partners but not guests. Our wins and tools, we appreciate the progress that the government has made. The government has set up adolescent health committees in 62 districts. Teenage pregnancy surveillance and response system initiated and scaled it up to 31 high burden districts, increased the number of districts with children reference groups. And also, this is the thing which I love most. The government made it easier for adolescent mothers to go back to school through providing guidelines for entry. And also linking schools to facilities, conducting community outreaches to improve access to services, availing toll-free lines and call centers to provide accurate age-appropriate information. Ladies and gentlemen, really the government is doing something great. To top on that, also during that day, the ministry also launched 3 major documents that will further guide implementation for adolescent health. And the first thing is the National Adolescent Health Costed Implementation Plan, which is from 2025 to 2030, and the Teenage Pregnancy Surveillance and Response Framework, the Annual Adolescent Health Report. And also as young people, since the new curriculum emphasizes us to be creative, we also showcased some brilliant ideas. We had peer-led HIV prevention models, mobile apps for getting the right information, and projects that are making us get money as young people. And also the big lesson I learned. Do you want to listen? Peer support and teamwork works. For real, no man is an island, so we need each other's support, and I really like that. That was the biggest lesson. And also to dive in more on our commitments and non-negotiable demands, we had diverse stakeholders from police, cultural leaders, ministries, district head teachers, COAs, NGOs, name it. Then to the government, ministries, districts, partners, religious and cultural leaders, fight child marriage and gender-based violence. Don't just slave the laws, enforce the laws themselves, and expand youth-friendly services and put mental health, life skills, sexuality education into schools and communities, ensuring that all adolescents like me and young people across everywhere receive this access. And community leaders and religious leaders, please, I beg you, you must champion the fight against harmful practices like female genital mutilation with alternative rites of passage in Sabay and Karamoja. You should also promote open and honest family dialogues. And I'm going to talk like the commitment as us young people we made. We commit to being the peer educators, as I'm doing, the community advocates and the mental health champions in our communities. We promise to be responsible and constructively engaged with leaders, mobilize fellow peers for services and opportunities in our communities. And for us all here, we must work together and use data to scale up solutions. Our immediate goal is to stop 1,000 daily adolescent pregnancies and make sure all young people, including those with disabilities, get fair access to services. The future of Uganda's adolescents and young people depends on what you do right now. Let's stop talking. Yes, let's stop talking, start mobilizing the funds and start acting. Empower us, the adolescents and young people, to realize our full potential. So this is the end of my manifesto, but as a young person, I wanted to leave you my poem, I really love poetry so much. It's one of the tools which I use during assemblies to educate my peers because we are a population of 2,000 students. So I'm going to present to you my poem, When I Whistle, When I Speak, When I Act, When I dance and swim to the rhythm of change, I rise. In my society, our society, there is this reality we strive in, a melody and tragedy that soars within, here and everywhere. With wings wide and can smile in the current tide, where dreams are left to bleed dry, where young seeds fed and cry, where madness thrives, FGM and GBV survive, clinging to young, innocent, tender souls, stranded and hard and thin, trapped in doom amid a society. My whistle begins. 10, 9, 8, 6, 7, 4, 5, 4, 3, 2. Let my whistle be your whistle because there is power in a lion's roar. Tough enough to withstand the storms in our society, tough enough to withstand the bullets that trigger the young adolescent. There is light to guide the lost that echo in your silence. You are not just voices. You are remedies to bring healing to my broken society, our broken society. Together, let's fight for the adolescents, for their dreams still unspoken, for the hope that refuses to drown. Let us rule with courage in this cure. Smile with pride in every corner. For change begins when we choose to whisper. Now, whisper. Thank you.
Wow, 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 wow. Another big hand of applause for a young person. She has ably said they don't want to be guests, they are partners. I think you have heard the others. They don't want to be guests, they are partners. Message is clear, the poem is clear. Thank you so much. Wonderful. We have a lot of talent. So allow me make this brief correction. I had omitted the chair of the Health Development Partners, kindly Madame Lunguzi, representing UNFPA, step forward to occupy the seat for Health Development Partners. And a clap for her. She's very passionate. Can take this side. Your seat is over here. As where the young person was submitting, we were joined by our Director General, Health Services, Dr. Charles Solaro. You're welcome and thank you very much for being here again. We're also joined by the Undersecretary, Minister of Health, Mr. Kenneth Akiri. He's also here once again. He was here at the beginning. Also at the start, our PPH Ambassador, Charlotte Kainerugaba, also joined us this evening. She's a very good supporter of midwives. And she told me that she had a gift for the best midwife in the country. So the best midwife at the award ceremony will get something from Charlotte. We now move to a representative of the civil society organization, another adolescent. Join me, put our hands together, and we welcome Dr. Lydia Mongerera. I had earlier given her brief, Dr. Mongerera. Since for you, you are very few, so we shall reduce the time. Over to you.
Dr. Mugabe, thank you so much. And it's very difficult sometimes to talk after such an inspiring talk that this young girl has given, but she has given us the picture. I'm going to be talking on behalf of civil society. I know I wear many hats, but here I'm representing RAMNAC, which is our platform. We have a civil society platform. I also represent civil society because I am the founding director of Mama's Club, which I founded 25 years ago, grassroots mother networks, and that was done. But I also coordinate civil society on the Health Policy Advisory Committee of the Ministry of Health. I think I'm trying to summarize. To summarize it, I will say that we are really appreciative of the government and Ministry of Health for always involving us. We represent civil society on almost all the platforms in the Ministry of Health, and we are very grateful. We want to thank Dr. Mgahi and the Reproductive Health Department. I've been a member of the Maternal Health Cluster since I think I joined HIPAC many years ago. So we are engaged and we are involved. What we want to talk about, just a few points. Strengthening community systems. That's very important for us to strengthen community systems and also integrators be involved in the integration process which is taking place. We want to make sure our participation as civil society is at all levels. And that is very important for us. We want to also talk about financing. We want to make sure financial systems, which include what we've been waiting for, the National Health Insurance. We've been waiting for the National Health Insurance Scheme, which is not yet in place, but we want to make sure that all finance systems and civil society is engaged. And as I mentioned earlier, engagement and involvement means planning, programming, implementation, monitoring, and evaluation. We also want to talk about the commodities because they affect us. Our people are in the districts, and we want to make sure there's a smooth flow of commodities. Talking about HR, the issue of midwives. For us, we know very well with the safe motherhood, the reproductive health, we need the midwives. The midwives are the most important people to us. They are the core of safe motherhood. At the same time, we welcome the community health extension workers. We know the community health extension workers from long ago. I was actually met them many years ago in Addis Ababa, many years ago when Ethiopia had started that system. But besides that, we want to be sure that there are other community structures on the ground. We know very well that CHOOS will work with the mother mentors, they work with the YAPs, and other people who are on the ground who are already existing, who are there, including the VHTs. We want to talk about accountability systems. We want to talk about mutual accountability. When we talk about accountability, it must be mutual. And of course, we've got tools also which we are involved in, the community-led monitoring system, which we started and is still in place, where we go and monitor in the communities how the quality of services, and we have that feedback mechanism. So we want the government to recognize that. We also want to talk about other programs which we know, of course, including the involvement. I was so happy to hear that people are talking about male involvement, because we know now that we need to involve men, we need to involve the fathers, and that's true. We want to talk about our commitment, and we want to commit ourselves to this partnership between civil society and the government and the Ministry of Health. We've been involved, but we want to recommit and mobilize our communities for safe motherhood. Safe motherhood is very dear to all of us, and we want to recommit ourselves. But remember, as we recommit, there must be resources, and we continue to call for domestic financing, because we know very well we cannot continue relying on external donors. So this is what we are saying as society. I was given 3 minutes only Of course, Dr. Mugahi, you cheated my time, but I will accept it. Thank you so much. And thank you so much that there's a number of civil society organizations who are here. And thank you for always involving us in the Safe Motherhood Conference. We have promised that we shall always be here. But of course, I really wanted to close by recognizing my civil society members. Jackie has been steering us. Jackie Turner, stand up. She's been steering us at civil society. We have Flavia, who's also been steering us. And I think, and of course, Fatia has been speaking here. She's also a member of civil society. There are many others, and I want to appreciate all of you and recognize you. Thank you very much.
Another big round of applause for Dr. Lydia. Thank you very much, Lydia, for representing the CSOs and the great work that you do along with Jackie. We really appreciate you. Keep us in check. There's nothing you can do without being checked, so we really appreciate that. DG, well, you're aware, and when you're on your way here, I assumed your shoes. I'm trying to fit in, but I'm requesting that you leave me in Entebbe Uwoma for a few minutes. This was supposed to be chaired by yourself, and I'm moving on well. I want now to invite the only bishop who has been here amidst us. He prayed for us. He has been meditating for us. Every night he meditates for the mothers, even the fathers. Safe motherhood is not about mothers alone, also the fathers. So hopefully next year we shall talk about survival of, yes. Your Excellency, you're most welcome. This has been a very special conference. As Her Excellency takes her seat, I think you can see the number of our bilateral friends who have been able to attend this conference. It shows you the importance of this very engagement. I now take the honor of inviting Bishop Amos Magezi to make commitments on behalf of the religious fraternity.
Good evening, everyone. Amos Magezi is my name. It's true I am serving as the incumbent Bishop of the Diocese of Northwestern Kole in Ivanda, but I'm here to represent Faith for Family Health Initiative, where I am also serving as a board member, and I chair programs and policy. And I'm a champion of family planning. And I would like to mention two things here. Some people misquote the scripture, and they say, well, there's no need for family planning because God said, multiply and fill the earth. But let me be honest with you, that is very true because the word of God is truth, but it's not only one couple that will multiply and fill the earth. And so we need to understand the interpretation of the scripture when it is saying multiply and fill the earth. But also on family planning, I am encouraging men. There is a tendency of men running away from family planning and they leave it for women. But guess what? When a woman gets pregnant, we'll wait for 9 months to produce only one child. But what will happen if a man keeps going around to many women? How many children will be born in 9 months. I mean, how many women will be pregnant in 9 months? Now, that's the scientific statement. I mean, you need science to interpret that, but you also can understand as a layman like me to understand that there is a need for men to go for family planning. I'm glad to be here in this conference, National Safe Motherhood Conference. And I would like to appreciate the Minister of Health for organizing this under the theme, Strengthening Multi-Sectoral Collaboration and Mutual Accountability for Safe Motherhood. When we were discussing, since the time we started, I remember on day one, they were saying, what can we fix as one thing, and then everything will be okay. To me, I kept quiet because you don't need to fix only one thing and then everything will be okay. Let me give an example. If you have a car and you fix the tires, but the engine is not working, what will happen to that car? Where will it go? What happens if you fix the engine, only the engine, and there are no tires? What will happen to that car? Where will it go? So I think the wisdom is in the theme itself, strengthening multi-sectoral collaboration. It means that everyone is needed. Everyone needs to do what he's supposed to do, what she's supposed to do, in order that everything will come in place. So I must say thank you to the Minister of Health and all the partners for organizing this and for bringing this to our attention, because this is exactly what we need at this time. So as religious leaders, we are committed to this. When we are talking about doctrines, we'll be separated because Muslims have what they subscribe to, Catholics have something what they subscribe to, and so depending on everyone's faith, you will have what you will go and subscribe to as far as your doctrine is concerned. But when it comes to socio-economic and community engagement issues, everyone must come on board. And so I'm glad that I've been able to be part of this. And as Faith for Family Health Initiative, we have been in this for the last 5 years. I would like to mention that for the last 5 years, religious leaders have organized pre-safe motherhood conference to commit and account. And last year, under auspices of Faith for Family Health Initiative, we launched an interfaith alliance as platform to continue engaging on safe motherhood. Now, today, one of the commitments that have been mentioned, for example, under the key actions, there was one which says launch a national culture campaign, engage culture and religious leaders to lead dialogues and shift harmful norms. I must be honest with you, if you bring us together, we are ready and committed to take the message, because we have the platform, we have the pulpits, we have the groups of women, or groups of men, groups of youth. And speaking of the youth, I was able to spearhead the task of forming the legal framework of adolescents' health in Ibanda district. And so just know that we just need the information. We are ready to go, but you need to involve us and give us the information, and we'll be ready to go with it and for it. I would like to once again pledge our commitment to go and serve the communities, because they need our service. And the only time we can do it is now, because leadership is for a reason and for a season. God bless you.
Thank you, Bishop. And indeed, safe motherhood is in the hands of God now. Seek first the kingdom of heaven, and all the rest will fall in line. We really want to appreciate the continued collaboration with the faith-based organizations, and they have a special platform for Ramka. They discuss how to translate messages, like the message he has mentioned, of it's not biblically correct that you give birth to any number of children. Healthy child spacing is godly. Looking after the children adequately is also godly. And I think we need to engage you more, and that is our pledge. Amidst us, as we also received the Her Excellency, the Ambassador of Sweden. Your Excellency, you're most welcome. She will be presiding over the next session, which is the awards. She's the chief guest at the awards. So, Your Excellency, thank you for honoring us and arriving on time. Chief guest, we also amidst us have a special group of people that I wanted to recognize. In the multisectoral spirit, we also have people from Ministry of Education. Ministry of Education represented by Mr. Semakula. Just clap for him because we just want to appreciate the multisectoral engagement, and they've been here. We also have amidst us a group of committed people called the coordinators of the NASMEC subcommittees. PPH, Dr. Samo Nonge, Professor Nachimuli, kindly stand up for recognition. If you are coordinator of a NASMEC, NASMEC is National Safe Motherhood Experts Subcommittee, we stand up and recognize you. We really want to appreciate you. Thank you very much. Thank you very much. In a special way, we don't want to forget our funders. Anyone who contributed, including energy and your mental power, please, we want to appreciate them and clap for them. We want to appreciate all the other UN agencies, WHO and UNICEF, because UNFPA is representing them here. Let's clap for WHO and UNICEF. Now, allow me at this point to invite the representative of the Health Development Partners. They plan with us, they provide us technical assistance, they give us resources, they tell us where resources are to deliver these packages. It's now my honor to invite Madame Juliana Lunguzi, representing the Chair of the Health Development Partners. You're welcome, Juliana.
Thank you very much, Dr. Mukai. I'm sitting here representing the Health Donor Group. UNFPA is chairing, but I need to recognize our co-chair, Sweden, and also co-chair WHO, all the other development partners, the DG and your team at the Ministry of Health, including the Minister AI, and also recognize all the other partners who are here, our doctors, our midwives, our health workers, all protocols observed. We, the Health Donor Development Partners, want to really reaffirm our shared commitment to work with the government of Uganda and all stakeholders to ensure that no woman dies while giving birth. There's nothing pretty, as our clergy said, you stay 9 months hoping to go to labor ward to deliver a live birth. And not only do you see a baby dying, but including the mother. We want to commit that we want to see this coming to an end. Safe motherhood is not the responsibility of the health sector alone. We have seen this in this conference. It requires collaboration across education, finance, local government, justice, and community systems. So we are happy that our colleagues from education and other sectors are here, and also to give a big hand to our young girl. We can see hope in that girl. We therefore pledge to strengthen multi-sectoral coordination, align our investments behind one national plan, one budget, and one accountability framework. The ministry has stressed this, and as health development partners, we align to this. And we also want to promote transparency at every level from national systems to the last mile. We do not want to leave anybody behind. And together we will champion mutual accountability, invest in innovation, and support Uganda's leadership in building a future where every pregnancy is wanted, every childbirth is safe, and every woman's potential is fulfilled. If you want to make a good Uganda, it starts with the woman. And that woman in the labor ward, we want her to be happy. If they are happy, the families will be happy. I thank you very much.
Thank you, Juliana. The people of Mane don't talk a lot. Now, DG, I'm going to request you, we have started the group of donors. DG, my supervisor, I'm going to humbly request that you step forward. I'll give you the protocols, and we are going to begin with World Bank, and then we follow with the Ambassador of Iceland, and then the chief guest for this closing ceremony is the Ambassador of the Netherlands. Our DG had more than 10 functions this evening. You know, he's a passionate Rotarian. He's a chief guest another place, but he's able to come here at the Safe Motherhood Conference. I felt if he allows me to continue, but he should make some comments, and then we proceed. Thank you, DG.
Thank you, Dr. Richard. I have allowed you to continue. Our guest of honor, all our partners, I think let me stand already on the existing protocol because, so first, my apologies for joining in late. And I imagine that if you are coming for the hour dinner, is this the dress code? There was no dress code which was given. But specifically, this afternoon, I have to join another group where today we commemorate the World Polio Day. So it gives me a pleasure to stand here. I think we have spoken about safe motherhood, but polio and safe motherhood are related because they provide a very comprehensive program for both women and newborn survival. So I want to take this opportunity. I am, apart from being the DG, I'm also a member of the Rotary Fraternity and the immediate past president of my club, RC Sunday. So allow me, in the spirit of integration, to share with you a word or two on this polio day as commemorate the safe motherhood. So today we join the rest of the world to commemorate the World Polio Day under the theme of End Polio, every child, every vaccine, everywhere. So as we come to the close of the fifth National Safe Motherhood Conference, Awards and Expo, there has been a global progress towards eradicating polio, a disease which has crippled millions, but now at the brink of extinction. The WHO estimates that vaccines prevent 2 to 3 million deaths every year, and vaccination remains one of the most cost-effective public health interventions. We use this day to reaffirm our collective resolve to reach every child, to counter misinformation, but also maintain high coverage. A polio-free Uganda and the world are within our reach. With unity, vigilance, sustained investment, we shall achieve it. I want to end by thanking all of you for all these contributions which you have made and your participation. I know it's late, and being here up to now is really a sign that of your commitment. Safe motherhood is for all of us, as you have heard, and all of us are part of the compact of safe motherhood. I want now to hand over to Dr. Richard Mugai to continue with the moderation.
and please accord him all the support you would have given to me. Thank you very much.
Thank you, DG. A big round of applause. And for his commitment, really, and we appreciate that, because polio is also another area that we need to address. DG, we shall complete the rest. Thank you very much, DG, but we are also privileged that the Undersecretary representing the Permanent Secretary is still here with us, and Ministry is fully represented with the other commissioners. Nursing is here, Commissioners Nursing, Assistant Commissioner AIDS Control Program, and all the other dignitaries are still here with us from Ministry of Health. Allow me, I've been allowed to invite the funders. Now allow me to invite my friend. I had earlier talked about him. The only thing that I strongly remember about Rogers is whoever is getting RBF at the health center for, the man behind it. He fought battles to institutionalize RBF in the mainstream government funding. Dr. Rogers Ayiko, representing the World Bank, then step forward and give your remarks.
Yeah, thank you very much, my brother Mugahi. Habari za jioni. Habari za jioni tena. Okay, good evening. Yeah, thank you very much. Rogers Ayiko is my name. I work with the World Bank as a senior health specialist. I'm not the country manager, just for avoidance of doubt. So I'm here stepping in for the country manager who would have wanted to be here, but she's still traveling from DC, where she was attending the annual meetings. The chief guest, Your Excellency, is present, the leadership of the Ministry of Health, and all the senior government officials, development partners, ladies and gentlemen. I think before I read a few of the comments that the country manager said I should convey here, I want to also say that we belong to the Health Development Partners Group. So what the chairperson relayed, we align with it fully. So it is a privilege and honor to address you as we conclude this conference. In terms of reflections of what we've picked from this meeting, we have had powerful stories, including from our daughter, who was just here, a lot of innovations and insightful discussions. The urgent need for coordinated, integrated, client-centered solutions for safe motherhood has emerged as a central theme of this conference. Clearly, we recognize that Uganda has made remarkable advances in maternal and child health, but we have very big pressures, which we typically don't see from the health sector. The issue of demographics, the issue of macro-fiscal pressures, and the issues of epidemiological trends that are shifting. And very significantly, the evolving health financing landscape, where potentially we could have lost about 25 to 35% of total health expenditure. So all the solutions that Bagala was reading here, we will have to implement them with about 35% less resources. I think that should be at the end of our mind. And then, of course, what that points to is that prioritization becomes like our number one word in everything we do. Planning, programming, policy, and everything. We must therefore act decisively, not only on the sector-specific recommendations, but also broader determinants of health, because that is where about 80% of the health problems come. Only through strengthened multi-sectoral collaboration and shared sense of accountability can we realize real change. On behalf of the World Bank, once again, and also the Global Financing Facility, represented by Grace seated down there and Scott, we want to express our sincere appreciation to all that have really moved this agenda of safe motherhood, and especially the frontline health workers who are taking thousands or hundreds of decisions every day to make our mothers get the best outcomes of healthcare. The World Bank and the GFF remain steadfast in its support of Uganda's development agenda. We look forward, maybe this is the form of commitment, we look forward to deepening our collaboration with the government and partners to achieve universal health coverage. And this is clearly because the World Bank president has committed to support at least 1.5 billion people across the world to access quality health services between now and 2030. And this almost translates to about 13 to 15 million for Uganda. So finally, may this conference serve as a springboard for robust and sustained action. May we leave not only inspired, but mobilized to do more, to do better, and to work together. I thank you.
So, today I learned a new word, that the clapping can also be anemic. Now the clapping we are doing is hypoglycemic. It's not only anemic, but hypoglycemic. And when you combine anemia and hypoglycemia, we are in trouble. So for a donor, we need to clap hyperglycemically. So we are working on so much with the World Bank. We are cooking with Rogers and the team and Dr. Murindwa, and hope very soon we shall be serving you. Thank you, Dr. Rogers, for your tremendous support to the survival of mothers and the babies in Uganda. Before I invite another friend of mine, I have been revising the name and I'm going to try it this time. I want to recognize two of our safe motherhood champions amidst us here. They've been very instrumental and they've recently retired, but they've really done a lot of work for this country. And one of them is Dr. Olive Sentumbwe, the most senior docent. Yes, we love you, Olive. You've done a great job. The other one is Maria. Olive worked for WHO, and she's now retired, but not tired, and we still won't need her. Maria, UNFPA. Maria. Yes, thank you, Maria. A very senior and seasoned midwife, worked with UNFPA. She's part of the reason we started Safe Motherhood and all the combing of the villages, hard-to-reach areas. And we really appreciate you, and I think we shall appreciate you people more. It's now my time to invite someone I met in Namayingo. Namayingo, Your Excellency, the team from Namayingo was here. The head of mission of the Embassy of Iceland, she's very passionate about maternal and reproductive health. The government of Iceland has been supporting Uganda through UNFPA on the fistula control and repair mission. I don't have the numbers offhand of how many women the money from your taxpayers has been able to give back dignity. Colleagues, you know what it means when a woman moves around with a fistula. I was in Namayingo to see the number of women giving testimonies who had fistulas corrected by our surgeons with the support from the people of Iceland. We want to appreciate you and ask you that we want more to prevent them now. We want more resources to prevent them. I'll be reaching out to you and we discuss the prevention strategy, but we really appreciate the resources that you gave us to repair the fistulas. And it's my humble honor to invite Her Excellency, the head of mission, Hildegard, to come and address us. I have tried.
Did I try?
So good. Good evening. That was very good. You got my name very well. Undersecretary, commissioners, religious leaders, development partners, ladies and gentlemen, good evening. My name, to make your life easier, my name is Hilda. I'm the head of mission at the Embassy of Iceland. I'm sure you're all exhausted after 3 days of deliberations, so I promise to be as brief as I can. But allow me to congratulate the Ministry of Health and the organizers for bringing together such an impressive and diverse array of participants. The conference is indeed a reminder that safe motherhood is not a privilege, but a right for every woman. It is the very cornerstone of public health, gender equality, and sustainable development. And I'm sure that during these 3 days, we have all learned, reflected, and networked, and celebrated the progress achieved so far. Maternal health indicators have improved remarkably over the past few decades, thanks to the tireless efforts of healthcare workers, policymakers, and community champions. Indeed, clap, because many of you are in this room, so clap for yourselves, please. Yet we really must acknowledge the persistent challenges that remain, adolescent pregnancies, obstetric complications, gender-based violence, and limited access to reproductive health services. Now, I am confident that the government and all stakeholders will continue to explore innovative solutions to address these challenges, and I'm sure that they have been discussed thoroughly for the past 3 days. Now, Iceland is proud to stand with Uganda in this journey, and as a humble, small partner, please indulge me a bit, but through our partnerships with district local government and development partners, Iceland has so far, as Dr. mentioned, supported the UNFPA STOP program in Namayingo district, addressing obstetric fistula and empowering survivors through treatment, rehabilitation, and reintegration. A key component of this program, in addition to restoring dignity, is to contribute to safe motherhood by equipping health facilities and strengthening the skills of health workers to make pregnancies and deliveries as safe as possible. Now, through our partnership with UNICEF Uganda, Iceland has supported improvements in water and sanitation facilities at health centers in refugee hosting districts in West Nile. Similar interventions have also been implemented in health centers serving fishing communities in Iceland's partner districts along Lake Victoria, further contributing to safe motherhood. Iceland has also partnered with UNICEF to support adolescent mothers and their children in Chiagegwa and Kikube districts, expanding their access to education and skilling, childcare and protection services. And we have collaborated with IPAS in Tororo district to expand access to reproductive health services and address the root causes of maternal mortality and gender-based violence. Please bear with me, I'm at my last point in my overview, but we are also proud to be part of the ambitious Heroes for Gender Transformative Action Program, led by the Embassy of the Netherlands, and we're very pleased and proud to be able to participate in that program. And Iceland's contribution enhances SRHR, GBV prevention, and WASH services for vulnerable communities in Kalangala district, implemented by a consortium led by Amref Health Africa. And good to see Patrick here. Nice to see you. These contributions reflect the government of Iceland's deep commitment to equity, dignity, and the empowerment of women and girls. And we are truly grateful for all the partnerships. Now, as we near the close of the 5th National Safe Motherhood Conference, let us not lose momentum. I'm echoing what has already been said, but good messages need to be reinforced, and that is to strengthen partnerships across sectors and communities, invest in health systems that prioritize maternal, newborn, and adolescent health, amplify the voices of women, especially those in underserved regions of Uganda, and most importantly, hold each other accountable to the commitments that we have made over the last 3 days. As I thank you for your active participation, your shared insights, and your commitment towards ensuring that every woman gives birth safely and with dignity, I wish I could end with a poem like Lucy, but I'm just not that talented. So allow me to end with your core message from this important conference, and that is, we have the solutions, now it's time to implement them. I thank you all.
Thank Thank you, Your Excellency. Juliana has offered to teach you a poem. But those of us who remember football, I joked with Her Excellency while in Namayingo that I only knew about Iceland when Iceland defeated England. A country with 40,000, Iceland is 400,000 people approximately, but beat England of 50 million people in football, World Cup. So they are a very determined population, and I really want to appreciate it. I think I told you that. So thank you, Your Excellency, for those wonderful remarks and for being a very good partner to the Ministry of Health and the government of Uganda. I want to invite the chief guest, but I can't manage to invite. I want to invite the chair of the Health Service Commission, Madam Christine Kakuru, to step forward, make a few remarks, and invite for us the chief guest. The name I will give it to you. Can you put our hands together and welcome? Christine is one of us, as she'll be explaining to us, passionate about safe motherhood, a mother herself. Today, I got to know that she's also a Nalongo. We have more Nalongos in the house. Yes, there's another Nalongo here. Thank you so much. Your Excellency, I didn't know you know the word Nalongo. Oh, wonderful.
Praise God. Good evening, everyone. I want to take this opportunity to first thank God Almighty, who has enabled us to go through these wonderful 3 productive days here. I kindly request you to join our hands and thank God. My name is Christine Kakuru, the Deputy Chairperson of the Health Service Commission. I'm here to represent the Chairperson of the Health Service Commission, none other than Dr. Henry Mwebesa. I'm glad that yesterday, but one, he was here to officiate and open officially the 5th National Safe Motherhood Conference. We want to thank him and recognize him in absentia, but well represented. Can we thank the chair? Allow me, before I proceed, recognize the Health Service Commission members who have managed to persevere to this time. Kindly stand up for recognition. When we started, we were all 7 members, including our chair, but today we have been blessed to have Dr. Nambiru to be with us and Madam Akum Janet Apai to be with us. The rest wouldn't manage to turn up. But today, at least we have managed to be here since morning up here. Why are we here? Because when we started and when we were discussing, among other pertinent bottlenecks contributing or as cornerstone of causing all these problems hindering safe motherhood was human resource. And when we talk about human resource, that is a very important but critical resource to manage in order to, facilitate or enhance the whole system of health. Allow me first to maybe highlight what it means and what it takes. When we talk about the health system, we need 3 things fundamentally. We need the inputs. Among the inputs, we have the human resource. And it is the very, very cornerstone of the health system. Without a human resource, the system can't stand. Mention it can be finance, infrastructure, ABCD, but the human resource is the cornerstone of health system. Then we can talk of the processes which we go through in our systems as clinical or healthcare systems. Then at the end of the day, we want to depend and lean on you, human resource, that we have the best desired output or outcomes as the satisfaction of our customers, that is, the patient. Allow me, before I proceed, I also express my heartfelt appreciation to the organizing committee, Ministry of Health entire, but the team which has spearheaded this. Kindly let's add on our hand clap to thank you so much. Imagine how we came from day one up to today. What we are deliberating on is very crucial as far as the safe motherhood is concerned. My appreciation also goes to not discriminating, but respecting all health care providers, from the directors in your respective capacities up to the last, I can call him maybe the support staff, because those are the food soldiers on grassroots who are helping us to have the other beautiful results which we had here yesterday, the other day, and today, where we have improved greatly in all performance indicators almost. Irrespective of the challenges that we came across, but for me, I have a belief that once we identify those challenges that we got as bottlenecks, we can turn them into opportunities for improvement. When you are performing, you can't fail or run away from challenges, but we can turn those challenges into opportunities for improvement. Yes, they are there. Every accounting officer, you are responsible to handle or look around. The DHOs present here, the ADHOs, the doctors, the nurses in your respective capacities, I want to thank you, because your being here in this room underscores our shared commitment as the recruiting agent on behalf of the government. We feel empowered when we see you here. We want to thank God for you. As the theme reads, strengthening multisectoral collaboration and mutual accountability for safe motherhood, it is not just a theme, but it is a call for action. And all of us, as we are here, there, me, I believe, and I'm contented that from here we are going to walk the talk. And by next year, we pledge together as a combined efforts that we shall have more improved performance indicators, God willing. It resonates deeply with core mandate of our Health Service Commission. We have our mandates. Allow me put it clear so that when you see us here, you know where we end and where we stop. Health Service Commission, in its special mandate or capacity, as established by Constitution of the Republic of Uganda, our mandate clearly is just to appoint persons in different offices from the lower up to the top, according to our jurisdiction. And we also, after appointing you, we go through a long process of recruitment. After recruitment, we assign people, or we recommend different officers to be appointed at different levels. We recommend to the president for higher offices, and others to the Ministry of Health to take also its mandate. We have to confirm people in service in those offices. We have the mandate to promote those people who are supposed to be promoted. We confirm and approve people who are going for study leave. We have a mandate to review the standing orders for the health workers. We have quarterly performance support supervision, where we have moved, at least most of the facilities you have seen us moving around, not only to recruit, but also to check and appreciate you. When we come to your facilities, we are not only coming to check the system, but coming to appreciate the work you are contributing to the entire country. We want to thank you and thank you. When you see us coming to you, our first aim is to appreciate you because you are there and you are contributing a lot. And then another mandate which I can't forget, when we appoint, we have also the mandate as a Health Service Commission to disappoint. Disappoint by disciplinary action. We take disciplinary for those people who are liable to be disciplined, those who can't abide by their expectations to work. So once we decide and then take an action, we can also remove the officer who was appointed in that office. Allow me to summarize. Our vision is a fully resourced health workforce that is responsive and effective. Our mission is to build a fundamentally strong and competent human resource base for efficient and health service delivery. So when they talk about all the other words, they talked mostly like 80% was praising you. Health workers, we thank you so much. We thank you and we are humbled before you that you are doing a lot. But the other 20% where we have the gaps and where we have to stand and turn them into the opportunities to improve. Together we can improve and go far. In line with our mission and our objective of this conference, I stand before you to make a firm commitment that from here, since we heard that the midwives, it ranked a very high toll there, when there are three things we work with, when the Ministry of Public Service has cleared you for appointing, you have your wage well saved, and then you have submitted and prioritized well according to the decisions and the action point we have gone with here. Our work will be made easy as Health Service Commission to recruit on spot that you have submitted for us rightly. So for us is to recruit according to our mission and vision. The moment you have a wage, you have a vacancy, it has been cleared, and then you submit rightly all the midwives. I think we shall do our due diligence according to the new structure, new staffing structure, and the scheme of service. We pledge to do our due diligence and serve you as it takes. The Health Service Commission is committed to prioritizing the recruitment as mentioned. We acknowledge the immense challenges. I've already talked about them. When we acknowledge those challenges as we walk around, we face daily with you the long hours you stand, the resource constraints, the emotional toll. Please be reminded whenever you are there that we hear you, we see you, we pledge our continued support wherever we can as Health Service Commission. We will continue to operate with our integrity, professionalism, and transparency as we, work with you in partnership because we can't work alone. While we face those challenges, I think we see way forward as positive because we shall stand on them as a firm foundation to find solutions. Once a challenge is found, the solution will be found. In conclusion, I thank you once again for your dedication. Let us live here reminded that safe motherhood is a business for us all. At every age category, it doesn't segregate. The Commission will play its part in strengthening the human resource. I encourage each one of us also to play our part to collaborate and hold each other's arm and be accountable. I've said all this for God and my country. Thank you for listening to me. The name is what? Allow me take this singular honor and opportunity to invite the chief guest, Boa Jan Sweding, the deputy head of mission, head of cooperation. Kindly, sir, you are invited to talk to the House. Thank you.
Thank you very much, and I apologize for all these difficult names our parents have given us. Good evening. I stand on the protocol that has been expressed so eloquently already over the last 3 days, and I recognize the presence of all of you, because you have Safe Motherhood at heart. Thank you very much for that. The Netherlands at present is the chair of a group of development partners working on sexual reproductive health and rights. And I'm deeply honored and pleased to provide the closing remarks of this conference. I congratulate the Ministry of Health, the National Safe Motherhood Committee, and all partners involved for a successful delivery and conclusion of this 5th National Conference on Safe Motherhood. To all attendants, your presence made a difference, and your contribution through the last 3 days is very much valued. We view this as a demonstration of your unwavering commitment towards this great cause. It's extremely appreciated. The conference has brought us great insights to what could be done to strengthen multi-sectoral collaboration and mutual accountability for safe motherhood. And it is our hope that you leave inspired and that lessons and recommendations from these past 3 days leads to a new horizon for women and girls. And I'm very pleased to see that during the synopsis, and thanks to the Icelandic ambassador, we already have the theme for next year. We have the solutions, time for action. And I think for the committee can that team on board. Through the 3 days of the conference, some messages kept resounding. And allow me to use this moment to mention some of the important ones. At first, safe motherhood is not only a women and girls matter. It's for men and boys too. A world that is safe for mothers is safe to all of us. We men, we boys, we have a responsibility to play. We cannot underscore the significance of involving men and boys in this journey to secure a Uganda where motherhood is safe and a joyous experience for every woman. It's important to keep the gender lens in all our efforts. Secondly, and I'm very pleased that partnership came across already during this closing event, while a strengthened multi-sectoral collaboration and mutual accountability is a potential game changer, strong leadership, both political and technical, at both national and subnational level, is the fuel needed to make this happen. Thank you very much, Ministry of Health. Thirdly, safe and healthy adolescence is a strong foundation for safe motherhood. The high occurrence of teenage pregnancies, child marriage, and rising cases of HIV new infections, especially among adolescent girls and young women, are indicators of an urgent need for a strong multi-sectoral collaboration and accountability for health and well-being of adolescents. And we all still remember the spoken words artist that we had this evening. Finally, while we explore options to secure increased funding for health, we need to deepen accountability for efficient use of available resources in every process and activity, including conferences and trainings we engage in to improve health and health outcomes. We should always choose the most cost-effective option and choose for value for money. Ladies and gentlemen, the conference has reminded us that safe motherhood is a right. We are the duty bearers and have the obligation to protect and fulfill this for every woman and girl in Uganda. When we fail in our duties, they carry the burden of our inaction. I call upon all of you, in your respective capacity, to play the role you can and make motherhood safe for every Ugandan woman. In the opening remarks, the chair of the Health Development Partners, a colleague of our UNFPA colleague here, expressed the commitment to continued partnership and mutual accountability. At the end of this conference, I am pleased to reiterate this commitment. Before starting the well-deserved weekend for all of you, I would like to thank you once again, using a quote of Henry Ford. Coming together is a beginning. Keeping together is progress. Working together is success. I wish us all that success. Thank you very much.
Another big hand clap for the donor. As I earlier mentioned, the hand claps must be hyperglycemic. So a big hand clap for all the panelists. Your Excellency, I want to thank you. Team West Nile, the money you have for the SRH project comes from the government of Netherlands, from the great people of the Netherlands. They're also a kingdom of Netherlands. And we want to thank Judith, who is also a minister. Judith, stand up and we clap for you. She has been the link between the Embassy of Netherlands and the Ministry of Health. Thank you so much, Judith. Our friends, our distinguished panelists and chief guests, I want to request that we take a picture with the organizing committee. They have done so much. They've been to your offices for the support. Organizing committee, please, we want to end this session. If you can do it in 1 or 2 minutes, please step here. We are slightly behind time. We still have dinner and awards, and we shall do those in 30 minutes, both. Organizing committee, only those who are available. Our dear distinguished chief guests and your team, I request that we step here and have a picture. Organizing team, don't use this picture for alone, because it has donors. Yes, the transition between the organizing disclosing ceremony and you can use even the stairs. I don't know if it works. Some of us are above sea level. We can see tomorrow. Those who are above sea level, you go down. Thank you, Emma. Emmanuel is our PRO Minister of Health. We appreciate you for coming. We clap for this team. They've done a great job. Me, I'm above sea level. They will see me. Oh. Thank you, organizing committee. Our distinguished guests, you can take your seats, your former seats. We want to really appreciate you. Thank you, organizing committee. Next year, do better than this. I think we shall have even Zoom cameras and everything. We really appreciate it. The cultural group, kindly manage the transition. We are allowing you only 5 minutes as we reorganize now to go into the awards. We have ticked off the conference with the summary of the events, the summary of the key points from the conference. We have now ticked off the closing ceremony. We are remaining with only the awards, and the chief guest for the awards is already here with us. I hope she's not looking at the time. The chief guest for the awards cultural team, Dr. Bakala, should just 5 minutes only just to, and feel free to stand when the culture gets into your head. or the dance gets into the culture. Feel free to stand. We are using this time to reorganize very quickly. The team in charge of the awards. As routine, this is the only conference that you hold as the Department of Reproductive and Child Health. We combine everything, awards, dinner, conference. So next is the team that is handling the awards, led by Pamela and Dr. Andrew. And the cultural team, please, if you don't have music, me, I can begin my culture because I'm also a cultured man. I'm a minister in Toro Kingdom, so I can begin my culture. And cultural team, take over. Emmanuel Aineviona, I want to invite you. Aha. Emmanuel Aineviona, our doctor by association.
Let's clap up. Thank you. Thank you. Thank you very much. Give them a round of applause. That was a commercial break. Good evening, everyone. At least say bonsoir to your neighbor. That is the French word for good evening. So you are welcome. This segment is the award ceremony that will be transitioning into dinner. And I have the honor and opportunity to invite Pamela, who is going to guide us through this award ceremony. Today I don't have much work to do. Pamela is going to lead us through this ceremony. Thank you. You're welcome.
Thank you very much, Emmanuel. Good evening, ladies and gentlemen. All protocol observed. We welcome you to the award ceremony for the National Safe Motherhood Conference 2025. Without a further ado, we are going to begin our program. We will begin with a word of prayer that I'll quickly give, and then we'll have the national anthem sung because our guest of honor was not here at the beginning of this function. Could we please stand up for a word of prayer? Father, we thank you for gathering us here again. We thank you for the gift of life. We thank you because you have appointed us to serve your people. We pray for wisdom, we pray for your grace and for your favor. And as we begin this ceremony, we ask of you to bless us and to bless everybody we are celebrating. And we pray that you be with us. In God's name I prayed. Amen. So you're most welcome. We'll have the anthems already. DJ, please. We'll only have 3 anthems: the national anthem, the East African anthem, and the Buganda Kingdom anthem. Just one stanza. Thank you very much. Before we could sit, I'm sorry, I'll make you stand again. In the past 1 year, we have lost some of our foot soldiers. Some of them have rested while at work in line with duty. Some of them have rested off duty. And we have also lost our mothers and babies in this motherhood journey. We would like to observe a special moment of silence for them, and we pray that their souls will be rested in peace. Yes, DJ, you are on the right slide. The next slide. These are some of those we have lost. We lost our own at the Ministry of Health. We lost some of those. We lost some midwives coming to attend this conference. And we pray that their souls will be rested in peace. Eternal rest grant unto them. May your perpetual light shine upon them. May they rest in peace. Amen. Kindly take your seats. We welcome you all to this 2025 award dinner, and this evening we'll run through very fast. But before we go, I would like to take you briefly through how we came up with this. This was an initiative by our leader. I believe we all know how passionate our leader, Dr. Richard Mugahi, is about safe motherhood in Uganda, and he really would like to appreciate and recognize all his foot soldiers at all levels and all cadres. I believe over the years you have noticed that the trends keep changing. We keep including those that are directly involved in care, but we also know safe motherhood goes beyond just the midwife, the obstetrician. It includes the ambulance drivers, the VHTs, neonatologists and neonatal nurses. We also have adolescents. We have a whole different web of people we work with. So this year you'll notice some cadres have been added, but subsequently we'll keep on trying to ensure everyone is brought on board. So without a further ado, I will be requesting the following people to come and support us with awarding. Douglas Akibua. We are going to run through the different LMNSs and we'll be displaying those that went through. This will be read by Dr. Jacqueline Akello. LMNS coordinators, kindly be ready to move as fast as you can. You'll be receiving these certificates of recognition for all the winners across the different LMNSs. Thank you.
Went through the process. Voting, registration, and then Okay, thank you, Pam. I write on the existing protocol that was started on Wednesday. Let's welcome Dr. Kiwa. So the process of awards, just briefly, we sent out nomination links to the different LNMSs, and people nominated the people who were performing or excelling in their different regions. After that, the list was vetted by the committee, and then we had another link sent out for voting. And so from each LNMS, we have the overall winner, and then the rest who made it to the nomination link get certificates. So the first category we are reading are those who made it to the nomination link, and then the overall winner will be announced later. So that was the process. Although we also have other special categories that did not come through the LNMSs. So we have Busoga LNMS. Let's have the LNMS coordinator for Busoga, Dr. Agri Bameka.
Then we have Yumbe LNMS, coordinated by Dr. Nzama Wilfred. And then we have Arua LNMS, coordinated by Dr. Fayo Victor. And then we have Kampala LNMS, coordinated by Dr. Nanzira Rachel. Let's have that 4. So I'll start with Kampala LNMS, the people getting the certificates. We have the obstetrician, Dr. John Wanyama from China, Uganda, Naguru Friendship Hospital. The medical officer who was nominated was Dr. Matthias Lugolovi from Kasangati Health Center 4. And the DHO who made it from Kampala LNMS was Stephen Mulindwa from Mukono District Local Government. And then the neonatal care nurse was Sister Claire Ahimisiwe from Mulago Specialized Women and Neonatal Hospital. And then we have Sister Abigasi Nalugwa from Kawempe National Referral Hospital. And the anesthesia and anesthetic category from Kampala LMS was Farida Muhindo from Kawempe National Referral Hospital. I'm also from Kawempe. And the implementing partner who got it to the nomination list from Kampala Metropolitan was Save the Children. So we will also need a representative from Save the Children. So we'll ask Dr. Akiwa. I think you're also receiving on behalf of Save the Children. Okay, so we'll start with the IP. So let's start by awarding Kampala LNMS. Dr. Akiwa can handle. So we expect that the different LNMSs will also organize a ceremony to recognize the names that have been read. But when we send out nomination links, we expect better competition. You realize the LNMSs that are getting 5 certificates, others getting 8. It totally depends on your participation as an LNMS. Okay. Next, we shall have Yumbe LNMS certificates. Yumbe. Yumbe, can we have the names for Yumbe, the obstetrician, Dr. Wilfred, who is also the coordinator, the pediatrician, Dr. Mubarak Nasur, the midwife, Sister Sali Aikoru, from Yumbe Regional Referral, from Koboko General Hospital, and the medical officer, Dr. Alex Dramadri, from Midigo Health Center 4, the DHO, Dr. Dennis Oloya from Koboko, and then the neonatal care nurse, Christopher Waswa from Moyo General Hospital, and the implementing partner who won from Yumbe is IRC, International Rescue Committee. We appreciate you for the support. Okay. Let's have Arua.
I've been requested that the teams that you're reading that they have won, they can come here just and we clap for them because people would like to. It would be nice. I know it takes a little time. As a way of appreciating you.
Okay, can we, as you prepare to come, let me read the remaining 2, but we'll have the teams come and take photos with our guest of honor. Okay, Arua LMS, the coordinator, Dr. Fayo Victor, was nominated as the obstetrician. The pediatrician, Dr. Anniku Gilbert from Arua Regional Referral. The midwife, Sister Julie Adokorach from Nebi General Hospital, Naimenti. The ADHO, Sister Jessica Draru from Maracha District Local Government. The neonatal care nurse, Sister Ngamita Jane, Arua Regional Referral. And the anesthesia, we had William Ochen from Omugo Health Center 4. Please prepare to come forward to take the photo. Arua LNMS did not nominate an implementing partner to be awarded.
Okay. Next, we shall have Kampala LNMS list. I think I read Kampala already. Okay. So the photo. Busoga, oh yes. Busoga, the obstetrician was Dr. Susan Chizala. Pediatrician, Dr. Emmanuel Tenywa from Jinja Regional Referral Hospital. Midwife of the year from Busoga, Sister Veronica Sempa from Chidera Health Center 4. DHO from Busoga Region, Moses Luja from Kamuli. Neonatal care nurse, Sister Mubarak from Jinja Regional Referral Hospital. And finally, the anesthetic officer of the year, Olivia Najuko from Nankandulo Health Center 4. Thank you so much for your participation. Can we have the different groups come forward? Kampala, LNMS, and all those who were awarded the certificates. Please, if you're around, come forward. Dr. Rachel and team, give them some music, DJ. Where are my Kampala people? If not, I will receive on your behalf. As Arua prepares, come forward if you're from Arua. Kampala. Arua team, move closer. Team Arua, please move to the stage. Okay. As Yumbe prepares, Yumbe, move on stage as Busoga prepares. Dr. Bamekan team, prepare to come forward. Busoga, move closer. Team Busoga, led by Dr. Bameka. Busoga, Dr. Chizala and team. So may I invite Rita to come and take us through the next category.
Good evening. I'll be reading the winners from Masaka LMNS. Gynecologist, we have Dr. Tony Mawanda. Pediatrician, we have Dr. Peace Nambusi. Midwife, we have Sister Sarah Nakajigo. Medical officer, we have Dr. Deo Gracious Kalinzi. Joel Harriers. ADHO, we have Sister Constancio Nachitio. DHO, we have Dr. Charles Matobu. Neonatal nurse, we have Sister Speciosa Amoit. And I'd like to invite the LMNS coordinator for Masaka to receive the certificates for the winners. Congratulations.
Masaka team, if you are here, please come forward so that we take the picture and you go back so that we don't have the... We need to save time. Dr. Senyondo and your team, step forward. Our chief guest kindly and our minister, let's have a picture with the team Masaka. Apologies. And you'll be reading the next one.
The next group is Bunyoro, so Bunyoro team and your LMNS coordinator, be ready. The one who will be awarding the next category is Miss Juliana Luguzi. Bunyoro winners, gynecologist Dr. Sebwami Leonardo, pediatrician Dr. Oburu Geoffrey Ofumbi, midwife Sister Kabasomi Penolo, ADHO Kugonza Susan, DHO Dr. Sabiti Edward, neonatal nurse Ayebale Immaculate, anesthetist Akusekera Unia. And as they're receiving their awards, Renzori LMNS.
Great.
Please, when you hear your name, run.
Let me provide further guidance. We want to go through this very fast. If we are going to tell you, like now, after Bunyoro, we announce it too. After Bunyoro is Rwenzori. After Rwenzori is Kayunga. We expect everyone to be in the hall. If we call your name and you're not here, we go on to another group. Thank you very much.
There's a party going on right here. A celebration that lasts throughout the year. So bring your good times and your laughter too. We gon' celebrate your party with you. Come on now.
Miss Renzori, Miss Juliana, yes. Renzori, gynecologist Dr. Martin Ouna, pediatrician Dr. Beatrice Chomgisha, midwife Kabasita Beatrice, ADHO Muhindo Zura, DHO Dr. Amon Bwambale, and neonatal nurse Bira Penina, IP Annabelle. Please run in case you're in the room. The next one is Kayunga.
It's a celebration. Let's celebrate.
Kayunga, prepare to come, and I'll start reading the winners so that you prepare to come. Gynecologist from Kayunga, Dr. Susan Tusubira, pediatrician Dr. Gloria Nakalema, medical officer Remy Ndianabo, ADHO Florence Namuyanja Ziwa, neonatal nurse Rose Biabwa, anesthesiologist Okia Moses.
Welcome. Don't walk it, don't drive. You're supposed to be jive. You look on me for best name, I love best name with no man. Boy, when I land, I land softly on the sofa floor. So far, so good. Money back out, let me see.
The next region is the Elgon region for gynecologist slash obstetrician, Dr. Emmanuel Tisime, pediatrician, Dr. Julian Abeso, medical officer, Dr. Susan Lunyolo, ADHO, Stephen Wanyala, DHO, Dr. Ephraim Nakoko, neonatal nurse, Sister Goreti Ayebale, anesthesia, Thomas Boyo, and their implementing partner, Seed Global Health. Ankola region, get ready. I would like to invite Irene Atkaire from Seed Global Health to come give out these awards, please. Miss Irene Atkaire. From the Ankola region, the following people get ready for gynecology and obstetrician, Dr. Fiona Asimwe, pediatrician, Dr. Mike Chewalianga, midwife, Sister Francisco Akampa, medical officer, Dr. Albert Alinda, DHO, Dr. Peter Sebutinde, neonatal nurse, Bashirat Sime, anesthesia, Ruth Charikunda. Irene Atire from Seed Global, please come give out these awards. Next, we shall have Shigezi LMNS. Please get ready. For gynecologist, Dr. Patrick Komagumu, midwife, Sister Devota Oyesiga, DHO, Dr. Gilbert Mateka, neonatal nurse, Sister Komujuni Naevare, anesthesia, Benny Kamagaju. Shigezi, LMNS. Next, we shall have the TESO LMNS. Please get ready. TESO region, gynecologist, Dr. Jackie Angwet, pediatrician, Dr. Moses Ochora, midwife, Sister Jen Akelo, medical officer, Dr. Annette Katsime, ADHO, Jude Olede, neonatal nurse, Sister Deacon, anesthesia, Joseph Eriapu. TESO LMNF.
Okay, so the next set of awards we have Lango, Acholi, Karamoja, and then Mubende. And I don't know if Joy Batista from Chai is here. I want to welcome you on stage to hand over the next set of certificates. If Joy is not here, then we can continue with the... Great, so we have the awardees from Lango, obstetrician and gynecologist. We have Dr. Ben Aiko. The pediatrician, we have Dr. Julie Ochol. The midwife is Stella Akite. Dr. James Olum as our medical officer in Lango. And then we have Semi Achiro, the ADHO. Dr. Jimmy Odongo from Amolatar as the ADHO. And then in neonatal care nurse, we have James Opio. Our implementing partner from Lango is Quam. Lango team, please come on board and we hand over the certificate. The Acholi team, please get ready. Come on board. So for Acholi, we have Dr. Geoffrey Akena as the gynecologist. Please step forward together with your LMNS coordinator. The pediatrician is Dr. Maurice Okao from Ambrosoli Hospital, Kalongo. We have the medical officer as Dr. Job Aeku Michael. The ADHO is Sister Grace Anena from Gulu. Dr. Dennis Ochula, the DHO from Kitgum Municipality. We have the neonatal care nurse being Albert Okanya from Gulu Regional Referral. The anesthesia or the anesthetist is Francis Okech Ouma from Gulu Regional Referral. And the implementing partner is APSI. Actually, team, please. WHO kindly join us forward. WHO. Karamoja team, please get ready. After this, Karamoja. Yes, we have Dr. Asa Sebuku as the gynecologist from Moroto Regional Referral. We have the pediatrician, Dr. Doreen Faith Longes. Midwife is Sister Fausta Aburu from Namendera Health Center 3. The ADHO is Sister Deborah Achia from Kotido. The neonatal care nurse is Sister Ruth Achom from Matany Hospital. The anesthesia or the anesthetist is Paul Nelson Maruk. The implementing partner there is also Quam. That certificate is also included there for Karamoja. Please step forward. The Mende team, please get ready. Our gynecologist is Dr. Isagara Peter. The pediatrician is Dr. Immaculate Mirembe from the Regional Referral Hospital. Our medical officer is Dr. John Yahweh from Sekanyonyi Health Center 4. The ADHO from Mubende is Sister Sarah Naskombe. I hope I got that right. The neonatal care nurse is Sister Ann Kakara from Mubende Regional Referral Hospital. And the anesthetist that took it from Mubende LMNS is James Wabuya. And the implementing partner is Alive. Mubende LMNS, please step forward. So I want to say congratulations to the different LMNS winners. Those who have gotten certificates, you emerged as the best from your LMNSs, and I want to congratulate you so much. So the next set of awards are the special categories, and I would want to welcome with me back Dr. Jackie back on stage to take us through the best of the best from all the LMNSs to receive the plaque. Dr. Jackie.
Thank you, Dr. Emina. So the next category are those who emerged winners, and they're getting the awards for their LNMSs, and we have 1,
her LNMS, and I would like to invite, I would like to invite Dr. Grace Mulinda from World Bank to award that category. So let's have the first LNMS, Tier 1, Outstanding Individual Organizations and Entities. Let's go to the first LNMS. Okay. Recognition for outstanding contribution to safe motherhood, Lango LNMS, and the winner is Nelson Loka. Nelson is an anesthetic officer at Anyege Health Center 4 in Oyam District, stands out as a champion for safe motherhood in the Lango LNMS with over 11 years of service. His work in obstetrics, anesthesia, and swift response to maternal and newborn emergencies have saved countless lives. Let's play for him, Yoleng. He comes from my region. Can we have Nelson's award, please? Lango LNMS. Okay, recognition for outstanding contribution to safe motherhood from Mubende LNMS. These are people who got the highest votes. Ruth Chazike. Ruth is passionate midwife with over 2 decades of service. Ruth, I'll not be able to read the entire profile because you're able to read. It's the same. Let's have the next LNMS. Okay. The winner from TESO LNMS is Dr. Joseph Emron, who is a medical officer and the acting medical superintendent of Katakri General Hospital. Dr. Emron.
Let's celebrate. There's a party going on right here. A celebration for you. So bring your good times and your laughter too. We gon' celebrate your party with you. Come on now. Let's all celebrate and have a good time.
Okay, let's have the next. The winner from Kayunga LNMS. Kayunga LNMS. Grace Jessica Zungu, who is a nursing officer from Kayunga Regional Referral. Because of time, we are not reading their profile, the entire profile, but hoping you can read through.
It's a celebration.
So for all those who have received the awards, please come forward. We shall take a photo with the chief guest in your different categories. Okay, next we shall have the winner from Chigezi LNMS. Chigezi, Dr. Godfrey Amoti Wampiri. Can we have some music as Dr. Godfrey comes? Please, if you've received a plaque, come nearer. We're going to take a picture with the guest of honor.
Let's all celebrate and have a good time. Yeah, yeah. We gon' celebrate and have a good time. It's time.
And lastly, for the first 6, let's have Renzori LNMS. All those who have received the awards, please come closer. You're going to take a group photo here. Okay, for Renzori, Dr. John, no, not John Bosco. No, John Bosco is not Renzori. Renzori is supposed to be Dr. Herbert Nzeke, not Oriema Bosco. Dr. Herbert, I know him very well. You're most Renzori LNMS.
Kuba niwe niyo shongare babaziro bamanyise nokamane papa sotija kwechangane bikuru syambe mazire nihombose kazobo bukwe pankandi baronzwa ndahire wenda kwiruka wenda kuzana ningo kwegama onyete nkubanjire
Masaka LNMS. Sarah Harriet, Senior Anesthetic Officer. Can we have this? After Sarah has received her award, come and take the group photo, please.
May I
request the first 6 who received the awards to come for the group photo with the chief guest? Please. Please play for us a song as they come. The first 6. Dancing. It's not easy to get a Safe Motherhood award. DJ, please. The song is not for dancing. Add more vibe. When you're done with the photos, we have bags for you. We have award bags. So Professor Joseph.
Professor Joseph Atviamjisha, if he's not here, Professor Nachimulis, kindly step forward. Dangerous substitute.
These are the winners in the overall LMNS. Yes. Recognition for outstanding contribution to safe motherhood, Bunyoro LMNS. The winner is Dr. Lawrence Kamya. He's a dynamic Ugandan physician with 5 years experience, with a 5-year journey in Kakumiro district. Let's clap for him. Please clap as he's coming. Dr. Lawrence, don't go away afterwards. Stay a bit near so that we can take an overall photo. From Kampala Metropolitan LMNS, the overall winner is Prosi Nabweteme. She's an innovative midwife from Wakiso Health Center. So please clap for her. DJ, give Sister Prosi some vibe.
I want to flex my love. I want to impress.
Please let's clap for Sister Prosi.
With this she loves. Mama, I want to impress. And I want to carry my love away. With this she loves.
Sister Percy, after, don't go very far, keep her feet close. For the general photo. Don't go very far. The next winner from Acholi LMNS, drum roll please, Rebecca Aliemo. Rebecca is a devoted midwife at Okinga Health Center 3 in Pada District. Let's clap for Rebecca. DJ please. Please send me up. Please don't go very far. Don't go very far. We are going to take an overall photo. The next from Karamoja LMNS, our overall winner is Dr. Longiro Mark. Please, a big hand clap for Dr. Mark. Dr. Mark, congratulations. He is a frontline health worker and transformative leader advancing maternal and newborn health in Karamoja. He works at Nabila Health Center for. Please, the hand clap for Dr. Mark.
I see this fine girl for my party, she wear yellow. Every other girl they do too much, but this girl mellow. Now in my fine situation, I go use this girl mellow. Finally, I find way to talk
from Elgon LMNS. The overall winner is Edith Akello. A big hand clap for Edith Akello. Edith is a devoted midwife from Bosano Health Center 3, Mbale District, one of Uganda's most hard-to-reach communities. Let's give a big hand clap to Edith Akello. Congratulations, Edith. Well done. Edith, don't go very far. The next winner from Uncle MNS. Drum roll, please.
This your body, you put him out for lockdown,
Uncle MNS. Sister Chemist Beatrice. A big hand clap for Beatrice. Is Beatrice around? No. Beatrice is, yes. Beatrice is ADH Obuntungamo. A big hand clap for Beatrice. If Beatrice is not around, the LMNS coordinator, you can come and pick Beatrice's award. Partner from Ankole. Next award to be read by Vanessa. Everyone that got an award to come and we take an overall photo as Vanessa reads the next winners.
The awardees kindly step forward, and our chief guest will take a picture. Vanessa, prepare yourself for the next phase.
Good evening. The next award category is for Busoga LMNS. Can you please have Mr. Kenneth Mtesa Sira from WHO to join us on the stage? The first awardee is Dr. Peter Diogo Nantamu, the DHO Ginger. Then we move to the next recognition is from Yumbe Element. Can we have Mr. Lulu Henry Leku, the ADHO of Ajumani District? For Bunyoro LMNF, the next award category, we have Dr. Lawrence Kamia, a physician from Kakomiro District. He was awarded. Then we move to the special categories. Recognition for outstanding contribution to safe motherhood, adolescent health. We have Mr. John Stephen Asimwe, head teacher of Busiro Church of God Primary School. Yeah, it's okay. The next recognition award for Best Data Officer for Blood Products, Mr. Kainamura Mbiro Innocent. Mr. Kainamura Mbiro Innocent. Yeah. The next recognition for outstanding contribution to safe motherhood, ambulance driver, Mr. Francis Chazima. Mr. Francis Chazima. Can we have all the awardees come to the front for a group photo?
What's next? What's next? Thank you. A big hand clap for this team.
Special awards.
Special awards. And I want also to mention that amidst us we have one of our own doctor who is also a musician, Mr. Kachumbala, Dr. Kachumbala. Kachumbali. So he will be entertaining some of our special guests as we continue with the awards. Pamela, can we have the next?
Okay, ladies and gentlemen, we are going to now go to the next category of special awards. As these people come in, let's cheer them up. They deserve it, and I will invite Mr. Kenneth Akiri to come and hand over these special awards. So the first one will be recognition of outstanding contribution to safe motherhood, the corporate social responsibility. Ladies and gentlemen, our awardees for this year is URSB. As you all know, this is a statutory body championing commercial and intellectual property, and it has extended impact beyond business to now saving lives. A round of applause for URSB. Let's clap for them as they take on this award. If the music is nice, you can dance to it as they take the photo. Okay. The next group of our deal is the recognition for outstanding contribution to safe motherhood. ADH Clinic of the Year, Adolescent Health Clinic of the Year. Ladies and gentlemen, the Yumbe Regional Referral Hospital Adolescent and Youth Friendly Clinic. In just over 2 years, the clinic has transformed into a safe, vibrant space where young people find care, confidence, and community. Let's give a round of applause for them. Yumbe, DJ, play for them a song. LMNS coordinator with your team, Dr. Commissioner Nancy. Okay.
Girl, I'll be foolish if I don't let you indulge me.
Ladies and gentlemen, our next category of our D is recognition for outstanding contribution to safe motherhood implementing partner. Let's welcome CHI, Clinical Health Access Initiative, for the grateful work they've done in the last year when it comes to safe motherhood. Team from CHI. Colleagues, as the DJ plays music, you can clap, you can stand up, and thank for them as well. Clap for them. They've done a great work. Okay, our next awardee is going to go to another implementing partner who has done outstanding work in the Rwenzori region, and that is none other than Enable. Through their support of We Care project funded by the Kingdom of Belgium, they've been able to penetrate Rwenzori region and have done tremendous work over the last year. So let's clap for them as they come to receive their award. Now we go to the best performing NASMEC subcommittee. This one does not mean others did not do well, but we've had excellent work from all our subcommittees in the last 1 year, but we could only have one that stood out. So allow me to welcome the National Newborn Working Group. For the first time, they did tremendous work. They've trained over 100 healthcare workers in neonatal in-service training. They are soon to graduate the first cohort of neonatologists trained trained in Uganda, but also they've activated the regional LMNSs, specifically for newborn. Dr. Deo and your team, as they dance this, give them a round of applause. They won first half of the last one here.
She said, I'm my love, you belong to me, and I belong to you.
That's like a winner.
You got killing somebody. Me say love is blind, but I just see her for
My baby's first cry, and I think it has improved down the net of care. It's being provided. So when among them we have some new cohort of neonatal fellows. So once they graduate, we shall have over 10 neonatal fellows graduating from that. So colleagues, I want to proceed to the next cohort of awardees. After the photo, you can now walk. We shall not play a song for you. You've already won. Okay, colleagues, our next awardee goes to the outstanding contribution to safe motherhood under the PNFP of the year. We appreciate the work all our PNFPs are doing in the country, but for this year, we wanted to give special recognition to Holy Innocents Children's Hospital, the only specialized pediatric facility in southwestern Uganda. And they've done a tremendous work in providing newborn care and child health care to the entire region. And you know, through the excellent NICU, state of art with CPAP machines and the rest and high quality instruments, they've been able to do great work. A big thank you to Holy Innocents Children's Hospital. Allow me now go to LMNS of the year. Out of our 17 plus LMNSs, we had one LMNS that stood out. And interestingly, it's among the youngest LMNSs, JP Farm Right. A round of applause to Yumbe LMNS. Yumbe LMNS, LMNS coordinator, our obstetrician. You can come with your pediatrician who is championing the newborn. Thank you so much. The Yumbe element serves the largest refugee population as well in the country. Over 600,000 refugees from the districts of Koboko, Yumbe, Kongi, Adjumana, and Boyo district. Congratulations to Yumbe LMNS. This shows how powerful the LMNS is. So probably next year we shall see more energy. But also we want to see the trends now falling. Maternal mortality, neonatal mortality, and everything. Okay, colleagues, we've had tremendous improvement in neonatal care in the country, and there is one outstanding mentor who has moved to facilities mentoring our midwives and nurses all over the country. And this award goes none other than Sister Damali. Sister Damali Mogerera. Sister Damali, do we have you here? Let's clap for Sister Damali. She's done great work. If you're in love of newborn care, let's clap for her. She comes to pick her award. Sister Damali is being escorted by a very huge army. I think they must be portraying us. Probably next year we shall have some of them being awarded as well. Congratulations, Sister Damali. As I wind my duty here, ladies and gentlemen, we have one outstanding pediatrician who recently concluded her fellowship in neonatology. But besides that, she has done tremendous work in mentoring fellow doctors in neonatology. And allow me invite Dr. Anita Tumwebaze, who has excelled as the outstanding mentor in the category of pediatric and neonatology. She's very passionate and she's dedicated to improving newborn survival and quality care in Uganda. Colleagues, do we have Dr. Anita around? Oh, I wish you had a representative. Whoever loves Dr. Anita, come and receive an award on our behalf.
So many will come and go. I am gonna come see your baby mama is a triangle.
Okay, so we have Pamela who will read out our last person. Then I will ask all our awardees in this category to step forward. We have a photo together with a guest of honor. Don't forget to pick your bags. Congratulations once again to our awardees of the year. Let's go.
Thank you very much. The photo moment for this team, please. Kindly walk up very fast. The hotel, I am very disappointed in you. I requested you to change the lights. I think this is why people are not clapping and getting excited. Kindly turn on the lights so that we enjoy the moment. We've been having this light for the whole conference. I beg that you change and put our mood into a better mood. Hotel, please, this is for you. Speak Resort Munyonyo. And before we go to the next, we'll have a mentor. But before the please, our Ds come on. We take the photo moment and we go. The next will be read by our PPA champion. She will be awarding our next set of awardees with Mr. Kenneth Akiri. You'll kindly stay here. And in this next category, please, the ones who are red, kindly increase the speed. The hotel, I am still waiting until you turn on my lights very well. I will not stop mentioning it until it's done. Except the photo is not curved very well. Commission, I think we need to make a straight line so that you appear in the photo very well, sir. So thank you very much, team and colleagues, to you all. We celebrate you. Continue the good work. Let us celebrate them, please. So in this next category, we have one special person. This person has gone beyond and over himself to train other anesthesiologists. He is also a call away in case of emergencies. And if you want to see his energy and passion, call him and tell him he needs to resuscitate someone. He will do it over and beyond himself. But interestingly, he is also a very serious professional DJ. Ladies and gentlemen, welcome with me none other than Dr. Agri Lubikire, the senior anesthesiologist from Kawempe National Referral Hospital. In the night, he's also called DJ Happy. DJ, please do not bore our DJ. His birthday cake always has his tools and his stethoscope. You have known Dr. Happy. We congratulate. Congratulations to you, Dr. Agri. Our PPA champion, you're supposed to kindly be walking up here to award. No. So the next is tier 2. Who are the champions? Thank you very much. In this category, we have people who have outdone themselves. We know in the different categories and workplaces, we have different energies, we have different things we put out to the table. But for this special category, they surely deserve a hand clap. I will not allow them to move if we are not clapping and applauding them. If you could please stand up because they have really outdone themselves. And the first champion is none other than Agnes Nambozo. Agnes Nambozo is a midwife from Bulambuli district. She has been cited several times climbing over the mountains, single-handedly, not facilitated, to go and reach MNH services to the people in the hard-to-reach areas. She is the best performing midwife. It is unfortunate that Sister Nambozo could not make it because she has an exam, but she sent this lady to represent her. However, Nambozo has been the best midwife and the best health worker. We appreciate you and we are proud of you. May the lives you serve, may the Lord count every good thing for you on the different lives you serve. We'll straight away move to another person who has also outdone themselves. The next champion who has outdone herself is Miriam Lokwi from Karamoja. She works at a health center 3. For those of you that have been to Karamoja, you know how hostile, if I could use some communities, can be. This lady is being awarded for her bravery during an emergency with PPH, where the community had refused to take a mother to the hospital, and this lady walked there with police and requested, with her skill, requested and explained to them what PPH was and that it was not witchcraft or anything, and she was able to convince this mother to come to the facility. And because of this, the whole community has believed in her. They always congratulate her and they do everything that she requests. Miriam Lokwi, unfortunately she's not here, but Kwam will receive it on her behalf. We appreciate her so much. Thank you, Team UNFPA, for the beautiful gift you're giving them. Let us move to the next champion. Vanisha Mugide is also one of those beautiful champions from the islands. She has been seen several times referring mothers on a boat, holding their drip and trying to resuscitate them as they move these mothers to the next level. Vanisha Migude, you're amazing. The Ministry of Health honors your work, and we pray that God will bless you for the extra hand you give. Let us give them a very huge round of applause. For this next category, I may not be the best person to relay this. I request my boss, the commissioner. Thank you very much, UNFPA. Let us have a group photo with our champions. The one who carried the one for Lokwi Miriam and the lady from Bulambuli plus Vanisha, please come over as we... And the last one, champion, is a lady who has served in the newborn unit for over 25 years. She has been a mother to the babies that have been abandoned. She has been a mentor to mothers who fear small and sick newborns. She has lived over and beyond her means. She's a support staff, but who has special interest in newborn babies. None other than Hasifa Namuli from Kawempe National Referral Hospital. We congratulate you, Auntie Sifa. Congratulations to the team. DJ some music, the hotel, I'm disappointed in you. The next category will be taken on by the commissioner and the chief guest and the undersecretary. Please do not go. And the commissioner will invite our guest of honor to also come and award this category. Madam Charlotte, we request you to come back, please. Thank you very much.
Wow, it's getting interesting. I was waiting for my name, I couldn't hear. But I am a strong believer that those who have not received like me, our rewards are in heaven. Amen. I have seen our rewards in heaven. These lifetime awardees are 3, and they are going to have special songs that they are going to usher them here. DJ can organize the music for these special songs, and I think our very own will also sum it up as we conclude. Prepare, I don't want any lap in this. Prepare their decorations, prepare everything. If you can clap, you clap. If you can stand, you stand. If you can stamp, you stamp. If you can ululate like Juliana, please do. It's an exciting moment. It's a moment to celebrate achievement. It's collective achievement. We are not saying that you're the only achievers. I want to begin with the first lifetime achiever, Dr. Jamil Mugalu. Dr. Jamil Mugalu is a consultant, senior consultant pediatrician and neonatologist with extensive expertise in neonatal and perinatal medicine. As head of the Special Care Unit and Neonatal Intensive Care Unit at Kawempe National Referral Hospital, Dr. Mugalu is a teacher. Dr. Mugalu is a clinician. He has trained most of the doctors in Uganda about neonatology, a very dedicated servant, a honorary lecturer at Makerere University. Mugalu has mentored countless number of professionals, Medical Association of Uganda, championing passionate ethical care. His leadership in clinical excellence, mentorship, and neonatal innovation makes him a standout lifetime achiever for safe parenthood. We congratulate you, Dr. Jamil Mugalu, for being one of the outstanding lifetime achievers 2025. A big hand of applause for Dr. Mugalu. You are the reason why Uganda is excelling. We want to appreciate you. And you remain here with your award. I want to move to the second. As I earlier said, if you can clap, you clap. Miriam Najemba Mwanja. Miriam Najemba Mwanja is a nurse. DJ, please. If you can have a Rusoga song. Is a nurse midwife and a public health leader whose career has shaped Uganda's maternal and child health landscape. From her days in Mulago Hospital to her days as the district nursing officer. That is what I want to see, the excitement. We honor you, we recognize you, and you are our lifetime achiever for 2025. Incredible performance. Thank you so much. You also retain you, Pamela decorator in the white color. She can remove the yellow one. Or she can do both. And I'm moving to the last one. The third lifetime achiever, Professor Dan Kekaye, an outstanding obstetrician gynecologist. Professor Dan Kaye has taught in Mulago. He has spearheaded sexual and reproductive health. He has published a lot of literature. He's a moving textbook. He's a moving textbook by himself. Professor Dan Kaye, a very humble man, very passionate about service delivery. Uganda is so proud of you and we want to recognize your outstanding achievement for the lifetime achievement of the year. This is special. I don't know how to make it more special, but these decorate Dr. Kaye, Professor Kaye. I'm going to request that the three stand in the middle. Yes, the three stand in the middle. Thank you. Thank you for your service. Thank you for your dedication. Thank you for your passion. We appreciate you. Photo moment. We want WHO, UNFPA. If there are any other ambassadors who are remaining here, Chair Health Service Commission, commissioners, please join in. Let's make it special for Dr. Olive Sentugwe. Join us, Commissioner Bafu.
Let us celebrate them, please, with a round of applause. Would like to apologize for the technical glitch. There is an LMNS whose champion was not mentioned, and it would be Dr. Oriema from John Bosco from Arua LMNS. Please move forward for your award, and we congratulate you. Dr. Oriema John Bosco, the Ministry of Health appreciates your work in Arua LMNS. As Dr. Oriema comes up, as Dr. Oriema comes up to receive his word on behalf of Arua LMNS, I request Dr. Ragala JP, who has been the chair for this organizing committee, to come forward and appreciate our different partners. And lastly, I'll have a gift from a former awardee that is going out to the Ministry of Health, particularly to the PS and the Minister of Health.
Right, thank you very much indeed. And I think it's really worthwhile for us to say thank you to the people who have enabled us to be here. And colleagues, ladies and gentlemen, let's put up a round of applause to Baylor Foundation Uganda, who have been our platinum sponsors for the NSMC 2025. Baylor. As Baylor comes, we can have Save the Children, platinum sponsor, NSMC 2025. As Save the Children comes, we have UNFPA, platinum sponsor. Yes, let's start with Baylor. I think this is Team Baylor, and then Team UNFPA. Dr. Mugahi, please, come and thank your people. Please. They have enabled us to be here. Okay, fine. Elma Philanthropies has been our gold sponsor. IPAS Africa Alliance, gold sponsor. AMREV, gold sponsor. The Clinton Health Access Initiative. We can get our awards and we can keep here for a group photo with the chief guest. Thank you. PSI, UNICEF, Maristops, Uganda, Japaigo, the World Bank, Dr. Mulindwa, the World Bank, Self-Care Uganda, my sister Rose, Self-Care Uganda, the World Vision, what is the World Vision? You did amazing. Stanbic Bank, if you're in the room, Stanbic Bank, DKT, you did amazing. Living Goods, thank you. Yes, Living Goods. And we can now have a photo with the chief guest and the representative of the Undersecretary. Please, with our sponsors who have really touched everywhere in this very difficulty of the stop work order to ensure that we have this mammoth of a conference. And I think you liked it, didn't you? Thank you. Let's take a group photo. We can also use the stairs. We can stand down. All right. Are we fitting in the photo? Let's. There we go. A round of applause to our sponsors. So we can. I don't think someone. Someone took it. Oh, one of the team. Thank you, Dr. And it's the other batch of partners that have enabled us to be here. The Danish Embassy, Bank of Uganda, Pathfinder International, Path, the Makerere University School of Public Health Center of Excellency for Maternal and Newborn Care, Nama Wellness, the Global Financing Facility from the World Bank, Mother to Mothers, they're doing some incredible job in Namaingo there. Nakasero Hospital, thank you. Adara, thank you. LifeNet, thank you. Vitamin Angels, Seed Global Health, Kachet Pharmaceuticals, if you're in the room, the World Health Organization, Value Global Health Foundation, and the Reproductive Health Uganda. Thank you. Without your phenomenal support, the 5th National Safe Motherhood Conference wouldn't have been a reality. Thank you very much indeed. Thank you. A round of applause, ladies and gentlemen. They have enabled us to be here for the 3 days, and they have sponsored a number of you, and that's how we made the 1,000 delegates for the NSMC 2025. Thank you very much indeed.
Thank you very much, Dr. JP. Dr. Richard Mugai, please don't go back. One of your awardees last year sent a special gift to the minister and to the PS. I would request that you deliver it to Mr. Kenneth Akiri. He will have it delivered. It was the old lady, the midwife last year, a Lifetime Achievement Awardee, who wrote words from her heart appreciating the recognition. So without further ado, I would request our Lifetime Achievement Awardees, our PPA champion, the guest of honor, Mr. Kenneth Achiri, the Undersecretary for Administry of Health. I would also request Dr. Olaro to come forward and we celebrate our awardees at the cake cutting. All our Lifetime Achievement awardees, our commissioner, Mr. Kenneth Akiri, our PPH champion, Ms. Charlotte, and Dr. Charles Solaro. To the cake table, please. Dr. Bagala JP, on behalf of the organizing committee, please join the cake cutting team. And immediately after the cake cutting, we'll have a photo moment. Lifetime awardees, Professor Kaye, Dr. Mugalu, and Sister Maria, please walk forward. I'm also reminding all our awardees with award plaques to please pick your paper bags. It might be hard to carry the plaque without a bag. Our Lifetime Achievement awardees, we are waiting for you, please. Dr. Mugalu. I think he has run back to the NICU. It's his favorite place. Professor Kaye is here. DJ, please, some music as we cut cake. Congratulations song. On the count of 3, 2, 1. Congratulations to all our awardees. Congratulations to the National Safe Motherhood Conference 2025. Our guests for the dinner, kindly do not leave. Immediately after the cake, we are having a photo moment. Organizing committee for the National Safe Motherhood Conference 2025. With the team that was cutting cake, please run forward for the photo. Organizing committee. Organizing committee for the National Safe Motherhood Conference 2025. Our PPA champion, I'm sorry, I'm going to get you tired. Our guest of honor, Dr. Richard Mugahi, Mr. Kenneth Akiri. Photo moment with the organizing committee as we walk out to the dinner.
Please, organizing committee, come forward. The last item is going to be dinner. Organizing committee.
We gon' celebrate and have a good time. It's time to come together. It's up to you.
Apologies for photo moment about every photo moment. That is how success is sweet. In my village, we had a saying that success has many grandfathers and failure has no grandfather. If you are short, you'll be in the middle. After this photo, we are going to sit. After this photo, we are going to sit and listen to a few remarks, very wonderful remarks from our chief guest. First way to take a picture. First way.
Let's celebrate. There's a party going on right here. A dedication to last throughout the year. So bring your good times and your laughter too. We gon' celebrate and party with you. Come on now. Let's all celebrate and have a good time.
Chief guest, I request that you remain behind. Her Excellency, the Chief Guest. Your Excellency, Her Excellency, the Chief Guest, I request you remain behind.
It's time to come together. It's up to you.
Her Excellency, the Chief Guest. Apologies, we delayed you. It was worth it, and we really appreciate you for the time. Let's settle down and listen to the wonderful words from Our Excellency, the Ambassador, and you're welcome, Your Excellency.
Thank you very much. And let me, at this point, stand on the protocol already observed. I recognize it's been very long day and days, and you are probably waiting for the dinner and the occasion to really celebrate each other together. So I will be very brief, and I apologize to the writer of my excellent remarks, that I will then just maybe leave them a little bit. And say that it's really been a pleasure and an honor to be here tonight to celebrate all this dedication and tireless efforts of the frontline health providers. I think it's such a wonderful initiative to take the time to celebrate each other and to recognize people that work so hard every day, and though they might get appreciation from the families and so on, to be brought to this occasion and get this very well-deserved recognition. I have to say it's something we could learn from in Sweden, because I have not seen it there, and it's really a beautiful event. Sweden is in health. We have supported health with a special focus on maternal and infant health for many years. We work on sexual reproductive health and rights. And I was very happy when I saw the awardees today to say that I've been to Kawempe Hospital. I visited the neonatal department. I've seen the maternal department there. I was even there with my minister. I've seen the work that's done. I see how much can be done, but I've also seen the lack of resources and the challenging working conditions that many people still work in. I've also been to the Arua Referral Hospital, and again, been amazed by the dedicated staff, but also struck with still limited resources that are. And as was said before, I am an Alongo. I have 2 boys myself. They were born 1 month early, and I was lucky. I was actually posted to Kinshasa, Congo, but I had the opportunity to go back to Sweden and know that I would be safe and my boys would be taken care of, which they were at the neonatal. So it's a very personal experience when I go visit and when I hear and I know the importance of midwives and all the personnel that works. I want to thank you, the Ministry of Health, of course, as well, the leadership provided with the Ministry of Health on daily basis, but also to putting us all together for a conference like this. Thank you very much. To all the midwives, you are the cornerstone of maternal newborn care. Your work is truly something special, and there is a lot of positive record to show for that. And also, of course, to all the doctors and specialists here who dedicate their time and skills around the clock to care for mothers and newborn. Some of you might know that Sweden has awarded the work of midwives in Uganda at a residence for many years, and I have done that for 4 years to get together with Maria, who was awarded the Lifetime Award here. So I was very happy to see her here tonight, and I have personally seen her passion and commitment for this, and also, of course, Makerere, a historical partner to us. So, as the time is late and you must be starving and tired and very anxious to maybe spend some time and celebrate in a more informal setting, I will maybe stop here and again just assure you all that Sweden remains committed partner to Uganda when it comes to health, when it comes to maternal health, infant health, and to ensure that women have an equal standing, and that when women and girls thrive, communities thrive, and let us continue working together to safeguard motherhood, strengthen health systems, and build a healthier world for generations to come. I thank you very much. I hope you had very good 3 days, and I wish you a festive evening, and I look forward to continue following the work all of you are doing. Thank you very much.
And thank you, Your Excellency, once again, and all our partners. I think the next agenda item is our dinner. And our dinner is ready. I'm told you have coupons. Dr. JP, step forward and where exactly? It's where we had last year?
Yes, thank you very much indeed, Commissioner. So we will be proceeding to the Sunset Restaurant. You have those invites, they're digital invites. The restaurant where we've been having lunch from, that's where we should proceed for the dinner. I would request our awards team, Divine, please let's take our guests to the dinner, and then the rest of us will follow.